My name is Sonia Ratan and my presentation is on Quality Improvement Plan. Quality in healthcare is defined as the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. It entails providing patient services in a technically competent manner with regards to cultural sensitivity, shared decision-making, and good communication. According to the Institute of Medicine, safe care avoids injuries to patients. The effective care is based on scientific evidence. Patient-centered care is respectful of and responds to what the patient prefers, needs, and what are his values. Timely care means minimal or no delays. Efficient care is based on full utilization of resources available with no wastage. And equitable care treats everyone equal and does not differentiate between a person's sex, ethnicity, geographic location, and socioeconomic status. There are several attributes of quality improvement. It is important that healthcare be safe, effective, patient-centered, efficient, equitable, and always be delivered in a timely manner. The safe attribute entails making sure the patient avoid injuries from the care that is intended to help them be safe and avoid injuries. The effective attributes involves giving services based on scientific knowledge to all who can reap the benefit and not provide the services to those that would not gain anything from it. Patient-centered attribute provides care to patient in a respectful manner and responds to what the patient prefers, needs, and what his and her values are. The timely attributes include reducing wait times and any harmful delay for people who receive and who give care. The efficient care is based on full utilization of all available resources with no wastage. This includes any wastage of machines, supplies, and energy. Equitable attribute includes treating everyone equal and does not vary because of the personal characteristics of a person, such as the geographic location, the socioeconomic status, their sex, or ethnicity. There are 4 types of quality measures: the structural quality measure, the process quality measure, the outcome quality measure, and the patient experience. The structural measure evaluates the physical settings in which care is being provided and the capability of that provider. As an example, the number of nursing care hours included per patient day. The process measure is used to reflect if the providers take appropriate actions that are consistent with professional standards and the required level of care, and so if their guidelines for monitoring and treatment are at the same level of care. Example, giving an antibiotic to surgical patients to help prevent infections. The outcome measures which captures effects of care delivery on a patient's health. Examples, some outcome measure assess the health status of people with chronic conditions such as blood glucose levels for diabetic patients and blood pressure levels for hypertensive patients. Patient experience means the quality based on the patient feedback according to their experiences. For example, were the appointments set timely? Did the provider communicate well? Were the communication skill good? And were the providers followed up on the test result in a timely manner? Quality improvement is everyone's responsibility in an organization. This includes the board of directors, the chief executive officers, all senior managers, and the leaders of the licensed independent practitioners. People should be held responsible for quality in an organization. Training and guiding parameters should be set up within an organization. There are several advantages of quality improvement. Quality improvement increases transparency in providers' delivery of healthcare and allows to identify the best performers and their best methodologies. This further enables researchers to develop and refine the best practices available. Quality improvement also increases awareness of the quality of care. Overall, streamlining the process helps to save time and money. Proactive processes are always more reliable when faced with problems. Quality improvement in healthcare is very important for basic reasons that enhance the readability of a patient's health condition. Due to the quality improvement procedures involved, when a patient is discharged from a medical practicing institute with an electronic health record that contains the history and the medical status of the patient and reflects the patient's health info to the individuals in the doctor's office. Overall, quality improvement yields better results. Quality improvement reduces the time of healthcare initiatives and helps the consulting concerned specialist. On the other side, there are several cons of quality improvement. The cons of quality improvement include the accuracy of the self-reported results may not always be appropriate. Although quality improvement measures are helpful, some measures will have unintended consequences. There may always be difficulty in evaluating complex clinical decisions and processes. The reliability of quality measures depends critically on the accuracy of the underlying data. Quality measures use administrative data, registries, medical records, and surveys from different patients as their main source. Each of these data has its own strengths and limitations when it comes to measuring quality. The current set of quality measures cannot evaluate various complex clinical decisions and processes. For example, measures have not yet been developed to identify diagnostic errors that are common and can often harm patients. Existing measures also cannot assess a physician's ability to manage patients with multiple chronic conditions, nor can they capture other aspects of care, such as a provider's technical proficiency or the accuracy of a radiologist's interpretation of imaging studies. Processes and conditions that are easily measured and considered appropriate form the main realm of the major existing quality improvement measures. To conclude, quality improvement should be a continuous part of healthcare operations, and everyone in the organization should be responsible for maintaining high quality standards. Data collection from quality improvement procedures should be done routinely. The overall pros of quality improvement outweigh the cons. Quality improvement enhances safety, effectiveness, and efficiency of healthcare and reduces medical errors and also helps in improving health services for individuals and populations to increase the desired health outcomes with reduced cost. Thank you.